is Dr. Stelina Gowdy. I am a board certified family physician, and I am the CEO and founder of Gowdy Family Care Center, located at 1500 Oglethorpe Avenue, Suite 3500 in Athens, Georgia. And what I'd like to talk to you all about today is the difference between a common cold and the flu. So let's start with the common cold. So common cold caused by rhinovirus. When you're in cold and flu season, very likely that you can get exposed to the common cold. And the most common symptoms include cough, congestion, runny nose, and sometimes some people just feel a little bit tired or a little achy. So most of the time, just taking over-the-counter medications is enough. So if it is more the runny nose and a congestion, taking an antihistamine over-the-counter definitely can help with those symptoms. And that would be like taking something like Claritin or Zyrtec. Also using Flonase, the nose spray definitely can help with the congestion. And of course, Tylenol, ibuprofen as needed. And making sure that you stay very well hydrated, lots of fluids, and getting some rest. Really important to get some rest. Now, the flu, a little bit different. It does have a lot of the similar symptoms of a common cold. However, with the flu, you tend to have the body aches and the fevers. For a lot of people, it really puts them down. I have a lot of patients who say they just feel like they got hit by a truck and they're just hurting all over. So treatment would be including supportive care, just like the common cold, but also you can take an antiviral. The most common one that's used is called Tamiflu. Now the Tamiflu does have to be started within 48 hours. So those antivirals that can't be used to treat the flu definitely would need to be started right away. So don't wait. If you start to feel really achy, really down, where you're not really wanting to do much, and I know for a lot of people it's hard to even make it to the doctor's office, but it is really important because you do need to have that diagnosis to be able to get the treatments. Now there is also the option of doing telehealth visit. Now, also something that we offer. If you don't want to come in to be tested, just the description sometimes could be enough. But of course, it's always great to be able to actually get a nose swab. Basically, what we do is get a sample nasal swab, and we would test that. If it is positive for influenza, which could be influenza A or influenza B. So if you're positive for either of those, then we can go ahead and get you started on the antiviral. Antibiotics will not help. Antibiotics is for bacteria, and the flu is not a bacteria, it is a virus. So definitely where you would need an antiviral to be able to treat that infection. Definitely go ahead and take some ibuprofen or Tylenol as needed for the body aches. All of the other supportive care definitely can help. Rest and fluids. For most people, symptoms will last for about a week, so about 5 to 7 days. Taking a medication, the antiviral will help with shortening the amount of time that you have the symptoms. So it's not where it's going to go away just like this. It's just going to shorten the number of days. So for most people, if you started right away, usually you'll have those symptoms for about 3 to 4 days of having the flu symptoms. Now let's talk about the flu shots. So the flu shot, one, definitely want to mention that every cold and flu season, the flu shot changes. So that would mean the flu shot that some people get it in August or September or right around that time, or October, that would be the start of the cold and flu season. So that would be a new flu shot. If you got your flu shot in like January or in March, and then that same year they're asking you about getting another flu shot, it is a different flu vaccine because that flu shot is different every season, every cold and flu season. So definitely recommend getting the flu shots. Um, Essentially, if you have something like asthma or COPD, definitely where you're at higher risk of complications like pneumonia or hospitalization. So for you, it's even more important to get the flu shots. I know some people say they think that or they feel that the flu shot gave them the flu, but it is not a live virus in the vaccine. What you're getting is basically protein that look like the influenza virus, and that is what helps your body recognize and produce antibodies so that when you're exposed, you're able to fight the infection. So definitely, also an important thing to know is that it does take 2 weeks. For most vaccines, it is going to take 2 weeks for it to be effective. So if you get your flu shot and you're exposed to the flu 2 or 3 days later and you get sick, that is because your vaccine has not had enough time to do what it needed to do to produce those antibodies to be able to protect you against the flu. So definitely, even if you get a little bit down, it's just similar to what people experience after getting the COVID shot, where they felt a little down or may have had some fevers, a little bit of body aches. That is more your body producing those antibodies. It's not that you are actually getting the flu from the flu shots. So definitely very important. And I also did mention people who have diabetes, because your immune system is reduced or depressed. You're also at high risk for complications, other autoimmune disorders. Also, where definitely even more important for you to go ahead and get your flu shot every year. All right, well, this is my little discussion about the difference between common cold, where you may have some mild symptoms, compared to the flu, where you're more likely to have much more severe symptom. Definitely important to get your flu shot. Remember to get your flu shots. But if you do get sick and you do need to be seen and get care, we're happy to see you at Gowdy Family Care Center. You can find us online at www.gowdyfamilycare.com. And again, we're located at 1500 Oglethorpe Avenue, Suite 3500 in Athens, Georgia. Phone number 706-410-2684. Looking forward to seeing you all.